Hi, I'm Michael and this is Carelifornia. And this video is going to be a companion to my earlier unemployment and covered California video, but this time we are going to discuss what you need to do if you're losing your health insurance through your work and are eligible for Medicare. And right now we are seeing companies across America being affected by the coronavirus and being forced to lay off some of their most experienced employees. Last month, we saw an unprecedented unemployment rate that affected millions of Americans. And one of the hardest hit groups of Americans by these layoffs are seniors. And now many seniors are faced with the sometimes frustrating and confusing task of getting health insurance through Medicare rather than their work insurance they were used to. So today we're going to go over what seniors need to do to move into Medicare after they lose their health insurance through work, as well as some important things to know about enrolling into Medicare and its costs. So there are a couple of common situations that seniors who are losing their health insurance through their work typically are in. The first and easiest situation is that you are currently 64 years old and will be turning 65 within the next year. This situation is fairly easy because if you're planning to take your Social Security retirement once you turn 65, you're usually automatically enrolled into Medicare. You should get your Medicare card 3 months before your birthday, and the cost for Medicare Part B will be deducted from your Social Security check automatically. Once you get your Medicare card, then you'll be able to review your Medicare health plan and prescription drug coverage options. This process to apply is usually pretty easy, but at the moment the Social Security offices are closed, in that case you can apply from the Social Security Medicare site, link in the description, or call to request enrollment. Now, a second situation is that you are already 65 years old but never applied for Medicare. And in this case, in order to get enrolled in Medicare, you'll need to reach out to Medicare and request enrollment. Normally, they'll ask you to submit two main forms to request enrollment. The first one is a 40B, and this form is to request enrollment into Medicare Part B. The second form is another form that your previous employer will need to fill out in order to verify that you had credible medical coverage from the time that you turned 65 until the date that you're applying for Medicare. Now, this may seem a bit strange, but one of the reasons this is done is because there's a penalty of 10% per year for people who were eligible for Medicare but didn't enroll and didn't have any other coverage that was credible. In general, credible coverage means that coverage was equally good or better than what is available through Medicare. If you have any questions about if your coverage through your work was credible, you'd want to contact your previous employer's health plan administrator, and they'll be able to let you know if it meets credible criteria. Another important thing to know is the cost for Medicare. Medicare has two parts, Part A and Part B. Part A for most people will not have a cost since it's what you paid into all the years when you were working. But Part B normally has a cost of $144 per month. For people who have higher incomes, this amount might actually be higher, but for the majority of Medicare members, the monthly cost for Medicare Part B is $144. And if you're taking your Social Security benefits, this amount will come out of your Social Security check automatically. If you're not taking Social Security, you'll get a bill in the mail from Medicare to pay for your monthly costs. This can be a bit confusing because many people think that Medicare is free. They work their whole life paying into Medicare and they didn't realize there's a monthly cost once the Medicare benefits start. In most cases, there isn't a cost just for the Part A portion, which is for hospitalization. But for Part B, which covers your day-to-day medical care like doctor's visits or lab tests, there is a monthly cost of $144 a month. Okay, now, so for those of you who lost your job and are in uncertain economic situations, there may be help to pay for your Medicare premiums through a couple of different government programs. These programs can help you pay for all or some of the costs associated with Medicare, as well as the cost for your prescriptions. I'll have to save that topic for another time because there's just too much information. But just know, if you're struggling financially, there is help to pay for your Medicare costs. And me and my team here at Carelifornia specialize in these types of programs for Medicare members, and we are happy to help you review your various free programs that assist with Medicare costs. So let's talk about time frames. So there are three main windows of time you have to enroll into Medicare. The first is if you're turning 65 years old, you have a 7-month window from 3 months before your birthday, the month of your birthday, and 3 months after your birthday to apply. The second window is if you're already over the age of 65 and are losing work insurance, you have a special enrollment period of 60 days to apply for Medicare without any penalties. And third is if you miss your 60-day window, you have to wait until the GEP or the general election period, which happens every year from January to March, to request enrollment into Medicare. If you enroll during the GEP, then your Medicare plan will not start until July of that same year. So in this case, if you enroll in January or February or March, your plan won't start until July. So needless to say, dates are really important because if you miss these enrollment windows, then you'll have to wait until next year's GEP to re-enroll. So that's it for today. I know this is a lot of information and it can be frustrating and confusing sometimes. That is why we here at Carelifornia are here to help. We specialize in individual healthcare, whether it's covered California, private health insurance, or Medicare. So please feel free to reach out to us or leave a message in the comments and I'll be happy to make a new video or post answers to your questions. So other than that, I'm Michael at Carelifornia, wishing you a happy, healthy